You look a bit more cheerful than the previous week. So can we say that you see more light at the end of the tunnel?
The situation is getting better day by day, but to talk about the end at the moment, I think we probably talk about it too quickly.
Too soon?
Too soon, eh?
Right.
So what does it mean? The fact that the number of new infections has been coming down steadily, it has to mean something, right? Something positive, of course.
Yes, of course. And I mean that the situation is getting better, as I mentioned earlier, and we hope that we have passed the peak, the first one, and we hope that we could maintain the situation or the transmission at very low level for quite some times. What I'm so afraid is that everybody's now learning the situation too, and they may start to probably relax a little bit. And as I mentioned earlier, it's not time for us to talk about relax yet. We should try to do our best still and hope that the situation will get even better in the coming days or weeks.
So in your view, all these existing restrictions, the partial shutdown, the curfew should stay, right? At least for the next few weeks.
What I mean is that the control of the movement and also the social distancing measures should stay. We may relax some rules a little bit, but I mean overall we should try our best to stay social distance.
And what is the number that can make you feel relief or to say that this situation is quite okay and the rules can be more relaxed? Do you have the number in mind?
No, not exactly. But what I have in mind is what we should do in the next few days and few weeks. This disease, so far, we were able to detect a little bit more severe case by looking at the case fatality rates. You can see that our case fatality rates is a little bit higher when we compare to certain countries like China. What we would like to see is that we would like to capture more mild disease patient with mild disease. In this case, if we want to do that, our activity in testing and try to do the active case finding, contact tracing, and identify person we should be should be a little bit more rigorous than the current situation. So this is not just the number. It is also about what we do. If we try to find the disease everywhere and we can find it, then I will be more relaxed. But so far, I think we need to do a little bit more active in finding the mild case in that end. So to be able to really answer what is the situation in our countries.
You mean
you're talking about more active testing for people with mild symptoms. Are you talking about any specific groups of people that we should focus on?
No, not exactly, because the disease itself may not be able to differentiate from others cold virus. So what I'm thinking about is trying to do the testing among certain situations. For example, if we saw the clustering of common cold, or what I would like to call corona-like virus symptoms, then I believe that we should do an extensive testing. Let me give an example. Let's say if we open up the department store and we start to find in certain department or in certain floor there are a cluster of case of common cold, then probably, and if we detect, let's say, a few numbers, 2 or 3 cases in the same floor, we should probably do more testing in some of that area or in some of those clusters to see if there is any other cases as well. In that ways, we can understand the dynamic of the disease even more.
I see.
So far, we have done quite a good job on trying to do contact tracing, and now I think we should improve our strategy a little bit so that we learn the situation of the outbreaks. This is not news. We have done this in certain provinces already. For example, in Phuket, they identified the cluster of cases in certain areas like in Bangla, and instead of waiting for the case to come in to the hospital, they just went out and do extensive testing in that areas.
And what's the role of village health volunteers in which WHO has complimented that Thailand has done so well by having more than 1 million volunteers in local community? What's their role, and should we increase the number of them?
So far, I have to say that they have done quite an excellent job, very good job on helping the health personnel. The very first roles, if you remember, is that when a few weeks ago, when Bangkok announced the closure of so many establishments, and everybody from Bangkok, the workers, went back home. That is one of the very, very beginning of their roles. That is, they help other health personnel to identify who came back from Bangkok, and then helping set up the quarantine system to track them and to monitor their symptoms for 14 days. And so far, I believe that they have done quite a great job. And now they are also helping in also doing the following up of the contact of the confirmed case as well. So not just doing those quarantine and monitor the health of those under quarantine. They also help with health education and trying to send a positive message, and also what people in Thailand should do under this situation. So they have so many roles to help us.
So for the benefit of our audience, can you explain to us a little bit more about the role of the health volunteers? Who are these people, and what kind of functions do they have on a day-to-day basis?
Usually they will help with before COVID, they work on several fronts. Like, for example, they identify the pregnant women in the village and encourage them to walk in and have antenatal care. They help us to do the larva survey to prevent dengue hemorrhagic fevers. So each year or each month, Ministry of Public Health will identify certain roles for our health volunteer to do. And then they went out to the village, and then they do their part. And then every month they will come back to what we call the health centers, or now we call health promotion hospital, to report back of what they have done in the past month, and also discuss about what is going on in the village, so that health personnel at the health promotion hospital know the situation and then can went in and fix the problem sooner.
I see. So you're saying that these people are very important connection between the health authorities and local communities, right?
Yes.
And Dr. Thanawat, regarding the case of foreign arrival, Thai returns from other countries, it is still the cause of concern, because if we look around other countries like Singapore or Indonesia, lately the cause or number of infections in those countries are from imported case. So what should we be aware of in Thailand?
I think we have set the system so that we can quarantine most of all of the incoming travelers. This is very important, and so far we have done quite a very good job to extend the facility so that we can accommodate more travelers more Thais who came back from abroad. But let's put it this way. We want to quarantine all of the Thais who return from other countries so that if they have symptoms, they are with us and they will not spread the disease in the community. That is our purpose. And we try to identify the more facilities so that we can accommodate more Thais who would like to come back. But we don't have that much resource at the moment. So let's put it this way. If we have too many returnees from abroad, then we may not have enough rooms to operate with to accommodate all of them. So far, that is why we would like to ask for help in trying to identify certain numbers to return, not too many, not too much at the same time, so that we can still do quarantine on those people.
Mm-hmm. Of course, your hope is to make sure that they don't come back in large groups at the same time, right? So how is this going to work out? You're working with the Foreign Ministry, the immigration police in making sure that there's some kind of a control on the numbers of people coming back. That's right.
We work with Ministry of Foreign Affairs. We work closely with the Ministry of Transportation, so that we have just right amount of returnees coming back from abroad.
Okay.
And Dr. Tanarak, I have seen your post on Facebook. You have raised the issue of we should practice moderation and self-sufficiency economy. Can you just expand and enlighten us on the very two issues?
This is just, let's put it this way. I have been asked recently by several of my colleagues to talk about what should we do next when the situation is getting better. What is the step of reopen? What establishment that we should allow to be open and what establishment that we should keep it closed? And how should we live our life in the next few months after the reopening? So I think about the teaching. First, I thought about the teaching of the Lord Buddha, that talking about the middle way or Majjhima Patipatha, and then I came across the teaching of our late King Bhumibol, that he gave us a very important lesson about sufficiency economy. It taught about the same things, that is, we should live our life and we should walk in the middle ways, not too extreme to one ways. The life in the extremes, we cannot live that ways for too long, no matter it's too strong or it's too weak. So I came across this, and it has all the component that I think we should follow at this time. It's talk about reasoning, reasonable act. It's talk about adequacies. The measure should be adequate enough and not too strong and not too weak, those kind of things. And we should use our knowledge and our merit to go through the difficult situation. So this is a very good teaching that I believe that everyone should keep in mind and should follow.
Okay. Dr. Tanarak, how did you spend your Songkran day and the family day today? I'm sure you must have been practicing what you preach. I mean, keeping physical distancing, and then not to be too close even to the members of your family, right? So how did you spend these important days?
I went to work, and so far this week has been very frantic for me. On Sunday night, I've worked very late, and so I have been a little bit fussy during the last 2 days. But I think it's paid off. Everybody is now feeling good about what is happening with the situation currently. and hopefully the trend will keep going.
But of course, overall, we have to be very aware of the global situation, right, Dr. Tanarak, in which what we see in Europe, in America, the situation is quite bad, with the number of deaths are quite high. So what should we be concerned of with the global situation surrounding Thailand at the moment?
As I mentioned earlier, at the moment we are trying to do our best in our country first, and then we now close the borders, and we've limited the numbers of people coming into the countries. If we can do this, if we can control the situation within the countries, and with the airport, we can control the people coming in and out. I believe that for the situation within our countries, we can probably control it. But as I also mentioned earlier, but we have to make sure that the situation in our countries is good, really good. So instead of just think that probably we don't have that many cases, I believe that we now have to go out and try to identify the case in the community as much as possible. And then we also have to follow the situation in other country as well. The people coming in through the airport, I'm not worried that much, but the ground transportation will be very important. So we have to keep our eyes on the situation of our neighboring countries like Myanmar, Laos, and Cambodia, because our borders is very porous. I mean, anybody can cross at almost any point. They don't have to walk through the important immigration point. They can just come in anywhere. So the situation in our neighboring country is very important to us.